Good morning students. Now coming to the therapeutic uses of the glucocorticoids. Now let us see about the rheumatic fever. So in rheumatic fever the glucocorticoids are given in very severe cases of the rheumatic fever. Actually in rheumatic fever the non-steroidal anti-inflammatory drugs play a very important role. Now the glucocorticoids are given because they are they have a dramatic improvement in the rheumatic fever, and they are given on the basis of their anti-inflammatory action. So due to their anti-inflammatory action, they are given in the rheumatic fever. They play a symptomatic role in the treatment of the rheumatic fever, and they are given in the patients of the carditis and the congestive cardiac failure. So they are given along with the aspirin, and when they are given along with the aspirin, they are given till the symptoms of the carditis and congestive cardiac failure they relieve. Patient feels better, and they are continued till the ESR comes down to normal levels. Later on the doses of the glucocorticoids are slowly tapered off, so they are slowly reduced and then they are stopped gradually. And coming to the next important use, that is in gouty arthritis. Now in acute gout, actually the non-steroidal anti-inflammatory drugs and the colchicine, they play an important role, and glucocorticoids are given as a symptomatic for the anti-inflammatory purpose. So because of their anti-inflammatory action, they are also used in gouty arthritis, and they are given in episodes where in cases who are not responding to the colchicine or the non-steroidal anti-inflammatory drugs, and they are injected into the joint cavity in the cases of acute gouty arthritis. Now coming to the next use, that is in allergic disorders. Now in various allergic disorders, they are given glucocorticoids, but they have a slow onset of action in the allergic disorders. Allergic disorders like the urticaria, the hay fever, the eosinophilia, then the contact dermatitis, then the angioneurotic edema, anaphylaxis, anaphylactic shock. So here they are given sting bite. So here they are given, but they have a slow onset of action. Generally in emergency, like in anaphylactic shock, adrenaline is a drug of choice, and glucocorticoids, they take time to act. So there is a delayed onset of action in these cases, and hence the drug of choice is adrenaline for emergency purpose. Then in minor allergies like the urticaria, rash, pruritus, insect bite, you can also give the antihistaminics for the allergic disorders. Then coming to the next use. Now coming to the important use in bronchial asthma. Now in bronchial asthma, glucocorticoids have a very important role. They are given because of their anti-inflammatory action as well as their anti-allergic action. So the anti-inflammatory and the anti-allergic action play an important basis for the rationale for the use of the glucocorticoids in bronchial asthma. Thirdly, they reduce the mucosal edema, and they also reduce the bronchial hyperreactivity. So the bronchial hyperreactivity is reduced because of giving the glucocorticoids. Then they reduce the dose of the beta 2 agonists which are given in the treatment of the bronchial asthma. So the dose of beta 2 agonist required is less if glucocorticoids are given along with the beta 2 agonist. Then the tolerance to the beta 2 agonist is also reduced, and the sensitivity of the beta 2 agonist to the in bronchial asthma is increased. So the dose required will be less. Dose of the beta 2 agonist which is required in bronchial asthma will be less. Now coming to the dosage forms, glucocorticoids are given in various dosage form. One is topical, that is inhalational route, and the oral and the intravenously. In status asthmaticus, it can be given by the intravenous route, that is hydrocortisone hemisuccinate is given intravenously every 8 hourly 100 milligram IV stat. Then in moderate asthma, it is given by the metered dose inhaler. It is also given by the oral route, but generally the topical route, that is by inhalational route, it is preferred than the oral route, because the side effects will be less by the inhalational route as compared to the oral route. Now coming to the next use, that is in the collagen disorders. Now in the collagen disorder, generally like the polyarthritis nodosa and the polyarthritis, dermatomyositis, here the glucocorticoids are given because of the anti-inflammatory action, and they are preferred, and the long-acting glucocorticoid generally with less mineralocorticoid action, they are preferred. Then coming to the next diseases, that is in the in the various renal diseases. Now in renal diseases like the nephrotic syndrome, they are also given, that is the due to their anti-inflammatory action. Here also the glucocorticoids with less mineralocorticoid action are preferred. Then coming to the ocular or the ophthalmic uses of the glucocorticoids, glucocorticoids are given in allergic disorders of the eye as well as in the various inflammatory disorders where there is a severe itching and irritation and redness of the eye. So because of the anti-inflammatory and the anti-allergic properties, they are used. Here they can be applied topically in the form of eye drops, or they can be given by retrobulbar injection, but they are contraindicated in herpes simplex keratitis. Then they are given in various skin disorders or the dermatological disorders like allergic disorders and various skin disorders like the urticaria, the rash, pruritus, itching. Here they can be given topically, they are applied. Then in dermatomyositis, in psoriasis, in pemphigus they are given. Then in exfoliative dermatitis and contact dermatitis they are applied topically. Then in hypertrophic scar and keloid they are injected inside the lesion. So they are given intralesionally inside the scar, hypertrophic scar and the keloids. Then coming to the hematological disorders. So in hematological disorders generally they are given in the immunological disorder, that is autoimmune hemolytic anemia. So in autoimmune hemolytic anemia, the glucocorticoids when they are given, they respond better to the glucocorticoids. Then in various lymphoid malignancies, lymphomas, leukemias, Hodgkin's lymphoma, non-Hodgkin's lymphoma, they respond better to the glucocorticoids because of the lympholytic action of the glucocorticoids, and they are given along with the other anti-cancer agents. Next important use is in shock. So in all types of shock, whenever the body is under severe stress, it is given, the glucocorticoids are given. They are life saving in shock like the septic shock, the anaphylactic shock, the neurogenic shock, or the hypovolemic shock. So in all types of shock they are given, and they are life saving in the treatment of the shock. Then coming to the organ transplantation, so to prevent the homograft rejection reaction, they are given before the surgery or even after the surgery they can be given, and they control the homograft rejection reaction because of its immunosuppressant property. They suppress the cell mediated immunity, and so they are given in the organ transplantation to prevent the homograft rejection reaction. Then in various intestinal diseases like the ulcerative colitis, here they respond well to the glucocorticoids because of its anti-inflammatory action. Here the methylprednisolone is given as a retention enema. So methylprednisolone is given in ulcerative colitis as a retention enema because of its anti-inflammatory action. Then coming to the next important use is in cerebral edema. Now in cerebral edema the glucocorticoids are given, but it depends on the cause of the cerebral edema. They are effective in cerebral edema if it is due to the brain tumors or due to the metastasis or because of the tubercular meningitis. In tubercular meningitis the glucocorticoids are given, but with the anti-tubercular drugs they should be given. Then they are not effective in cerebral edema due to the head injury. Then the glucocorticoids without salt and water retention activity, that is without mineralocorticoid activity, should be given in the cerebral edema. So these were all the important uses of the glucocorticoid, therapeutic uses of the glucocorticoid. So in today's class we have covered the almost the adverse remaining pharmacological action, then the adverse reaction, then the contraindication and the therapeutic uses of the glucocorticoids, as well as the classification of the glucocorticoids. So with this we end today's class of the glucocorticoids. Thank you, and please subscribe to my channel if you are not subscribed to my channel. Thank you very much.